Hello viewers, welcome. If you are new on our channel, so please remember to subscribe our channel to get latest video notification. The most prevalent disorder of the foot is a hallux valgus deformity or a bunion. Bunions develop when bone or tissue at the joint on your big toe shifts out of place. Narrow shoes, hindfoot malalignment and heredity all most common to contribute to the development of bunions, especially in women. The deformity is also seen in patients with rheumatoid arthritis and other inflammatory conditions. Pressure and abnormal motion on the joint will force your big toe to bend, causing a painful lump to develop or a bunion. You can relieve bunions by adjusting your shoes, by wearing bunion splints and orthotic devices, and by doing home care to reduce the pain. In addition, you can also use massage and foot stretches to help relieve your bunions. Most bunions can also be treated with surgery. If your bunions become too painful, you may want to consider getting them surgically removed. Here are some best tips to get rid of bunions without surgery. Method 1. Step 1. Adjusting your shoes. Wear shoes that have a wide toe box. You can relieve the pressure on your bunions by wearing shoes that have a wide, flexible sole that supports your feet. Shoes like sandals, athletic shoes and soft leather shoes are all ideal as they will provide support and space for your bunions. If you wear heels, you should try to keep your heels low, no higher than an inch off the ground. Step 2. Buy shoes that fit your feet properly. When you are buying new shoes, you should ask a sales associate to make sure the shoes are not too narrow for your feet. They can measure your feet and help you find the right size so your new shoes do not agitate your bunion further. Make sure the shoes fit properly by walking around in them in the store to ensure they do not pinch or squeeze your toes. Do not believe the myth that your feet do not grow once you reach adulthood. In fact, your feet can get bigger and wider as the ligaments loosen and your arches flatten over time. Step 3. Put orthotics in your shoes. Orthotics can be placed inside your shoes to help realign the bones in your feet. They can also reduce the amount of pressure on your bunions, which can make your bunions less painful. You can buy orthotics over the counter at your local drugstore or pharmacy. Keep in mind, orthotics are usually a short-term solution to bunions and feet pain. You can also get prescription orthotics from your primary care doctor or from a podiatrist. Prescription orthotics are custom-made for your feet so they will fit your feet properly and provide the type of support you need. Step 4. Tape and pad your bunions. You can tape your big toe with medical tape so it lays straight, forming a splint. You can also buy special bunion splints that are worn over the top of your foot and your big toe to help straighten the alignment. Only use a splint with the guidance of your doctor. You can also use moleskin or gel-filled pads on your bunions to protect them and prevent them from rubbing on your shoe. You can get bunion pads over the counter at your local pharmacy or online. Method 2. Step 1. Doing a home care. Ice your bunions to reduce swelling. Your big toe joint may be painful and swollen due to the bunion. You can relieve this discomfort by applying an ice pack to the area several times a day. Icing your bunions can offer temporary relief. Wrap the icy pack or a bag of frozen vegetables in a cloth. Apply it to your bunions 20 minutes at a time. You should also get in the habit of elevating your feet after a long day of standing or walking. This will help to reduce any inflammation on your feet due to your bunions. Step 2. Take over-the-counter painkillers. You can alleviate some of the pain and discomfort caused by your bunion by taking OTC painkillers like ibuprofen and paracetamol. If your bunion becomes too painful and uncomfortable, you may need to consider surgery to remove them. Follow the directions on the label for dosage information. Keep in mind, taking OTC painkillers is only a temporary solution for your bunion pain. Method 3. Step 1. Using massage, stretching and exercise. Massage your feet with your hands. You can do a quick 10-minute foot massage at home using your hands. Massaging your feet can help to loosen the tight muscles around your bunions and on your big toe, reducing pain and cramping in this area. Start by using your thumbs to massage right beneath the mounds of your toes. Step 2. Dortch lifts exercise. You can stretch your arches by doing arch lifts at home. This will help to stretch and strengthen your arches. making your feet feel less cramped and sore. You can do this exercise on an exercise mat. Start by standing with your feet hip-width apart. Then lift all 10 toes and stretch them upward. Slowly lower them back down one by one. Raise only your small toes and keep your big toe on the ground. Extend your big toe forward and down toward the ground. Then ground your big toe mount and inner heel down to the ground. This will keep your arch lifted and strong. Step 3. Try toe stretches. You should also do toe stretches by moving your toes up and down on the ground. This will help to stretch and strengthen your toe joints. Lift and extend your big toe several times. Extend it forward like you are trying to push a button in front of your toe and then slowly lower it down. After you do this several times, you may notice the muscle that runs from your inner heel through your inner arch to your big toe is starting to ache. This is a good sign as you want to work this muscle, the adductor hallucis. Then lift all of your toes and extend only your little toes out and down toward the ground. Do this several times. Finish by lifting your middle toes and spreading them out. Then extend only your big toes and little toes out and down toward the ground. Step 4. Do low-impact exercises to avoid agitating your bunions. You should stick to low-impact exercises like walking, swimming, or stationary biking. These activities will not irritate your bunions as much as high-impact activities like running, martial arts, or contact sports. If your bunion become less painful and uncomfortable over time, you may be able to resume high-impact activities and exercises. Now that you know how to get rid of bunions without surgery at home, I hope you find this video helpful. If yes, then please hit the like button below. Make sure you subscribe us because we post any dye-related video every single day. If you have a request for a video, so please be sure to leave it in the comment section below. Thank you for watching. Take care, bye-bye, bye-bye.